Hello, everybody. Welcome to the Obesity Matters Wellness Workshop, where we embark on an incredible journey together towards better health and wellness. Whether this is your first time with us or you've actually been with us since we started this program, we are so grateful you are here. My name is Rachel. I'm the Vice Chair of Obesity Matters, and I am your host for this year-long program. Today's topic is rest and resilience, managing sleep and stress for better health. And how fitting, because this happens to be National Sleep Month. So it's a great time to give ourselves a little sleep checkup. I'd like to welcome Dr. Sara Ahmed with us today. And Sara, do you mind sharing a little bit about your background and the work that you do to help set up today's conversation?
Absolutely. Well, thank you so very much for having me over here. And it's a pleasure to be talking to you all about a topic I'm so passionate about. I'm Dr. Ahmed. I'm an internal medicine physician, and I'm also a specialist in obesity. I run my own practice in Burlington, Ontario, Canada. It's a weight management practice, and I also have my own separate internal medicine practice as well. I work out of Hamilton Health Sciences, and I'm an associate professor with McMaster University as well.
But my first question for you would be, why do you think we tend to crave unhealthy foods after a bad night's sleep?
So it's an interesting question, but before we really go into answering that question, I would like to explain how sleep is exactly related to our metabolism and our appetite regulation. See, our body follows a biological clock, a circadian rhythm. And according to that rhythm, we release certain hormones at certain time routines and specific time periods. For example, when we are awake, we have certain hormones that are being released. We have cortisol, we have insulin being released. That is regulating our metabolism. It is regulating our energy levels to basically carry on the regular duties of the day. When we are sleeping, we have the production of melatonin, we have the production of prolactin, we have also the production of growth hormone, which are also crucial for regulating our metabolism. If any of these cycles are disrupted, then our metabolism overall is disrupted. For example, like the hormones that I talked about, the cortisol and the insulin should not be released at nighttime. They should be at their low levels, okay? Similarly, there shouldn't be a high level of melatonin being produced during the day either, because that's going to impact our metabolism. So any disruption in the release of those hormones, if they are out of whack, if they are out of their regular routine, that's where we will see impairment in our metabolism itself. Now, when it comes to appetite regulation, we have multiple players in our appetite regulation. Some of the key hormones that regulate our appetite include ghrelin, which is a hunger promoting hormone, leptin, which is a satiety promoting hormone. When we sleep, our ghrelin hormone should be low and our leptin levels should be high. That's why we don't typically get hungry when we are sleeping, essentially, right? Similarly, when we sleep, essentially, we are getting a rest in our mesolimbic pathway, which is our reward pathway. If we disrupt our sleep by any way, we are activating this reward pathway at an inappropriate time, which makes us seek more rewarding foods, okay? This is the endocannabinoid system in our brain, which is tied to the release of dopamine and opiate itself. So basically, activation of this system at inappropriate times during the nighttime can lead to inappropriate cravings for food. Then the third thing that is typically involved if we have our sleep impairment, whenever we are not getting good deep sleep levels, we are not getting a proper REM sleep. Now, REM sleep is the rapid eye movement stage of the sleep, where we are essentially dreaming. If we are not getting that stage, we are not regulating our mood effectively. This stage of sleep is crucial for our overall emotional regulation. And if this stage is impaired, then we become more impulsive, we can become more sensitive to environmental triggers, and therefore it takes us, just a simple trigger like looking at the television and watching a burger, like, from McDonald's or something like that, making us crave a burger. So that sensitivity is heightened when we are not getting enough of REM sleep. So to your question, why do we crave more when our sleep is impaired? It is because of these three mechanisms: impaired release of the ghrelin hormone, which is the hunger promoting hormone. 2 is the activation of the reward system in our brain, which is happening at inappropriate times. And 3 is the impairment of the REM sleep, which is tied to our emotional regulation. With regards to the sleep hygiene, right? So first of all, how can we improve our sleep hygiene? Make your sleep routine consistent. Go to bed at a specific time of the night. Wake up at a specific time during the day. Keep a discipline around that. Make sure that nothing disrupting the initiation of the sleep. So what are some sleep disruptors? Sleep disruptors include caffeinated beverages. We have like screens itself, right? Like, the blue light from the screens itself has an impact on the release of the melatonin within our brain that makes us have an impaired initiation of the sleep. Caffeine actually blocks the production of adenosine. Adenosine is a very crucial neurotransmitter in our brain, which basically promotes sleepiness within us. So impaired production of adenosine is tied to the excessive caffeine consumption itself. Having your dinner at least 4 hours before bedtime and nothing to eat afterwards would help you ensure better sleep. Why is that? Because glucose and ingesting glucose with dinner or carb with dinner itself can also trigger release of excessive dopamine in your brain, which can also impact the quality of sleep that you will be getting throughout the night. Alcohol itself. A lot of people have a glass of wine to basically help relax. But it is counterintuitive because it may promote the initiation of sleep, but it will destroy the architecture of the sleep. So it will really impact the deeper stages of the sleep itself. So reducing the alcohol intake is equally important. Similarly, avoiding strenuous activity or exercise routines, like, at least a few hours. Don't try to exercise within the 3 hours of time spent within your bedtime. Try to exercise beforehand. I know a lot of people have limitations with regards to their work routines and everything. Better to exercise in the morning or earlier in the afternoon time period than later on in the evening itself, because that can have an impact on the sleep itself.
Yeah, I definitely resonate. And I have so many examples in my own life of how I see that all playing out. Those are really great tips. I particularly know that very impactful for me is a very early supper. Where I am, we call it supper, our last meal of the day, and not having any alcohol in the evening unless there's something really special, but just really avoiding it, and the screens, which is kind of my nemesis. But I do want to make sure that we shift over into the stress side, because it's so related. And even when you're talking about the sleep piece, you talked about the idea of carrying a lot of stress. Like how we see that play out is that maybe we're waking up at various times during the night and we're thinking about that thing that we know that's happening in our life that's really hard and difficult, which would make us think that playing out in our brain. So maybe that's a sign that we're not hitting all of those phases in the right way. So, with that, what are some daily habits or practices to help prevent us from, that chronic stress?
See, the thing is that we can go on and on that topic. And that's what I typically like to do with most of my patients. To simplify, my recommendations, I would say that let's try to look at how do we approach de-stressing, okay? A lot of the times, I ask young moms coming in or ladies coming in, how do you handle stress? And the most frequent answer that I typically get is that once my kids are off to bed, I like to turn on some Netflix, watch Netflix, and grab a bag of popcorn. Or sometimes I do get a craving of having a bowl of ice cream at that specific time. It's a usual common story. People like to watch television as a way to relieve some stress and the pressures from the day itself, right? But is it really that beneficial? That's my question. Because, when we look at leisure, when we look at de-stressing, we have two forms of leisure. One is active leisure and one is passive leisure. Active leisure incorporates activities that require some form of mental stimulation and some form of physical stimulation itself. And this is very, very important because having that mental stimulation where it incites your thinking, incites your creativity, improves your thinking capabilities, helps you in identifying goals and acquiring a skill, or planning out a way to achieve the goals. It is basically enhancing your self-efficacy. It is enhancing and boosting your self-esteem itself. Taking up music lessons and playing a little bit of piano, maybe solving a jigsaw puzzle, maybe talking to a friend and really having like an enlightening conversation around a certain topic itself. Maybe picking up an activity such as knitting, or that's where we used to see a lot of our grandmas knitting and things like that. That's still active, I would say, right? Another form of desensitization and de-stressing is a thought download. Have a diary by your bedside. Write out all your thoughts. Make sure that these thoughts are not something that are still on your head. They have been externalized onto the paper before you actually fall asleep. And this will significantly help improve the quality of the sleep and eventually de-stress as well. Last but not the least, if by any chance you have a slight bit of suspicion that you may have sleep apnea, get that assessed for and get that treated. I cannot stress enough how important it is to manage sleep apnea, and it is one of those medical conditions that go undiagnosed in many, many situations. Now, if I am to go into sleep apnea, let me tell you what it is. Sleep apnea is a medical condition where we are obstructing our airflow. When we obstruct the airflow, the oxygen delivery to the brain is not sufficient. When oxygen does not get delivered to the brain, our body goes into a panic mode, releasing a lot of cortisol at night, a lot of stress hormones at night when we are actually sleeping. And our cortisol levels and our stress hormones should be very, very low when we sleep. So when we are elevating our cortisol levels and these stress hormones at inappropriate times at night, we are then causing impaired production of cholesterol. We are causing excessive production of blood glucose. This can put us at risk of diabetes and hyperlipidemia and even hypertension as well. So our blood pressure starts to rise up, and this can all contribute to the development of cardiovascular disease. Now, I haven't even gone to the impact of sleep apnea on the heart and the lungs, but let me tell you this, like when you also have sleep apnea, you're also not producing or releasing carbon dioxide effectively. So you're supposed to breathe in oxygen and release carbon dioxide, right? So when you retain a lot of carbon dioxide in your body, your muscles are not going to function properly. It's going to promote more insulin resistance, and you will not burn calories, further contributing to progressive weight gain. And if you're trying to take medications for weight loss itself, the medications won't work until you treat the sleep apnea. So it's very, very important to also be mindful of, sleep apnea as a medical condition. If there is a suspicion, please speak with your doctor and get that treated.
Thank you so much for bringing that up. That is so very important. Thought I had also seen some links between someone having sleep apnea and also even Alzheimer's. So I'm sure based on all the things you said, that could also be included, I would think.
Because again, sleep apnea is also impairing the architecture of your sleep too, right? And as I said, there are stages of our sleep which are involved with memory consolidation, with our frontal lobe activity. So if any of those are getting impaired, then we will develop dementia or Alzheimer's down the road.
Hi there. I have a question from myself as well as Rochelle. And you had spoken, Dr. Ahmed, you had spoken about sleep apnea, but we'd love to hear about insomnia, anxiety-related insomnia or depression-related insomnia, and if antidepressants can impact weight in any way.
Absolutely. Very important questions. See, insomnia is such a common condition. Like I should have talked about it earlier, but thank you so much for bringing that up. There are different types of insomnia. There is an insomnia where we have difficulty initiating sleep, and then there is insomnia where we have difficulty maintaining the sleep as well. So when we have anxiety related issues where we cannot stop our brain from thinking when we lay down on our beds, that's the insomnia where we are having difficulty initiating sleep. I typically like to, in that setting, first of all, it's always about lifestyle interventions that you can do in your regular routines. And that would include making sure that your sleep hygiene is right on point, making sure that, your meal intake was 3 to 4 hours before bedtime, making sure that there were no caffeinated beverages, making sure there was no strenuous activity, making sure that you are in a nice, calm, cool, dark room where you are not having any form of sensory stimulation that would impact your ability to fall asleep. Yet, if you're having difficulty stopping your brain, as I said, thought download, externalizing your thoughts and writing it out typically should help. Maybe, sometimes some people I've seen use noise canceling devices, the white noise machine itself, which can be utilized, and it helps, inducing the sleep. There are calm applications, like on the phone, there is an application which plays a gentle music. It's a form of a light distraction just so that it takes you away from overthinking and it makes you fall asleep. If none of those strategies are working, then a good way to treat insomnia is to take trazodone. Trazodone, in my experience, is a very good medication which can be taken half an hour before bedtime. It helps to stop or slow down your thinking so that you can have a better quality of sleep. It does not cause any dependence. It does not cause any weight gain. It's perfectly safe. If you decide not to take trazodone one specific night, not a problem. You can always take it the next day. So you can always get back to it. It's a very safe medication in that regard. I use it very frequently in my practice and it helps my patients quite a bit. There are other medications. Some people use zopiclone. I have my reservations against zopiclone because it has some weight promoting effect and it can cause a little bit of dependence. I would never recommend taking Ativan or lorazepam or midazolam, clonazepam. These medications are old school medications, but they are weight promoting and they can also cause dependence. They don't improve the architecture of the sleep at all. There are newer medications in the market, such as Devigo, and this medication itself can be used to improve the architecture of the sleep and maintain the consistency of the sleep. So if you're a person who goes to sleep okay, but you're waking up multiple times in the middle of the night, then Devigo might be the right medication to take because it helps improve the architecture, and it is also not a weight promoting medication. With regards to antidepressants, right, you had talked about antidepressants and how it can be tied to insomnia and whether antidepressants can cause weight gain or not. So there are different categories of antidepressants. There are some weight promoting medications and then there are some weight neutral medications. Weight neutral antidepressants include more so bupropion. Bupropion, in fact, helps promote a little bit of weight loss. There is a medication, venlafaxine. Venlafaxine, I would say it has neutral effects, it's not weight, it doesn't contribute to weight loss. In some situations, I've even seen venlafaxine causing a little bit of a weight promoting effect too. So I'm a little bit on the fence with the venlafaxine itself. Other medications like citalopram, sertraline, paroxetine, they are actually weight promoting medications for antidepressant. They in fact cause more visceral adiposity the adiposity deep within your belly. So it's better to stay away from those medications. Fluoxetine is a weight neutral medication when it comes to antidepressants. And certainly taking these medications is important to regulate your mental health itself. But knowing and speaking to your doctor about potential side effects and its impact on the weight is very, very crucial. So whenever you're having a conversation about antidepressants, do bring that topic up. How is it going to impact my weight down the road? I'm sure that would help the physicians kind of revisit their decision on the medication itself.
Thank you for joining us today. Remember that our journey towards better health is not a solitary one. We are here to support and uplift one another. See you next time.